Hello and good afternoon, everyone. Welcome again to the channel. I hope you are all doing fine and safe. Uh, let's take today's topic, and today's topic is about convulsions. See, hospital ward. The carer part is you are the parent of a 12-year-old girl. Your daughter had a convulsive seizure, which is epileptic fit, earlier in the day at school and was brought to the hospital by ambulance. A nurse has just come to tell you that your daughter is about to be discharged from the hospital, and you decide to ask her for information what to do were your daughter to have another convulsive seizure, epileptic fit. Task: ask what epilepsy is and what causes epilepsy. Second, explain your concern that your daughter may have another convulsive seizure and that you need to know that what you should or should not do. Third, ask what you should do if your daughter appears disoriented or begins behaving strangely. Fourth, ask when you should call an ambulance. Fifth, ask what other support might be available. Let's come to the nursing part. Nurse, the parent of a 12-year-old girl asks for your cooperation in answering questions about a convulsive seizure and what to do if his or her daughter had another seizure following her discharge from hospital sometime later today. Listen carefully to the parent's questions. Do your best to answer the questions. Stress the need to stay calm and not become over anxious. Task: briefly explain epilepsy, disruption of electrochemical brain activity, and general symptoms. Example: muscle jerking, sometimes post-seizure tiredness or incontinence, etc. Explain what the parent should do if the daughter had another convulsive seizure at home. Example: lie on the side, remove harmful objects, no objects near mouth, check breathing, etc. Fourth, explain when to call an ambulance. Fourth, finally, explain that there is an epilepsy foundation which could, on request, give the parent more information about epilepsy. Its details will be in the local telephone book or the internet. So let's begin without any delay. Hello, good afternoon, ma'am. My name is Ashish. I'm the registered nurse for today. How may I help you? Hi, good afternoon. My name is Samantha, and I have a 12-year-old daughter. She just had a convulsive seizure and early in the day at school, and she was brought to the hospital. Now the nurse has come to tell me that my daughter is about to be discharged, and I decide to ask the information about what to do if she's supposed to have another convulsion. So I want to know what exactly is epilepsy and what causes epilepsy. Well, ma'am, sorry to hear that you going through all this right now. However, let me assure you that the situation is not that serious, and if we follow the preventive measures and take the necessary precautions, she should be fine. So let me first explain to you what is a seizure. Well, as we all know that our brain functions based on certain electrochemical functions, electrochemical brain activity. Whenever there is a disruption in this brain, in this electromagnetic activity, it results in a seizure. The general symptoms include muscle jerking, sometimes post-seizure tiredness, or incontinence. Okay, I see. I am worried that what if she has a seizure again? Then what should I do and what should I not do? Well, ma'am, in case your daughter has another seizure at home, you need to make sure that you do follow certain things and certain steps. First of all, you need to make sure that she lies on the side. When she lies on the side, it will help to release the drainage from the mouth, or if there are any fluids in her mouth, those will be drained on the side. This will help her not to get choked on her fluids. Second most important thing is that you need to make sure that you remove any harmful objects which are in the surrounding area of your daughter, because when, of course, you know that when she's going to have a fit, she will be having jerking movements. So that time we need to make sure that there's no hard object which might hurt her. Third thing, of course, there should be no objects near her mouth as well, and also we need to make sure that her breathing is normal. So as you know that usually an epileptic fit lasts for approximately 1 minute, after which usually the patient goes into a deep sleep. So these are the certain things that you need to make sure. And so what should I do if my daughter appears disoriented or begins behaving strangely? As we just discussed, in case you have any such indications, just make sure that you follow these steps, and you should be fine. And when should I call an ambulance? Well, ma'am, as soon as you feel even a little bit indication that she might be in the process of having a seizure, make sure that you call the ambulance immediately, because so that they can come to your help as soon as possible. Okay, I see. So what other kind of support might be available for us? Well, ma'am, there is an epilepsy foundation which could, on request, give you more information about epilepsy. They have done a great job in helping the parents and the patients to handle these episodes in a very organized manner in order to prevent any mishap. So I have seen that they are very cooperative, and I'm sure they will be able to definitely help you and guide you, as you are currently, it's just the first incidence of the epilepsy, and we of course need to make sure that you know all the aspects of the epilepsy and what to do and what not do, apart from what I just said. I'm sure they'll be of great help to guide you out. So if you want, we can connect you. Apart from that, there are details of them in the local newspaper, and also a local in the telephone book or the internet. If you want, even we can connect you with them. Okay. I hope I've answered all your questions. Anything else I can help you with? No, that's about it. Okay, ma'am. So I have explained you all the steps and the precautions for the epilepsy, and I hope and I wish that you are able to handle this situation in a strong way, and I hope everything is fine at your end and your daughter's end. Thank you very much, and you have a great day. Bye bye. So guys, here we just saw today how to handle sensitive situations like epilepsy, when the patients, they come in the first instance who might be disoriented or they might not have any guidance. This is how we can empathize with them, and we can also give them support and positivity by using our body language and positive words. And of course, reassurance is something which has to follow each time in any of the role plays. So make sure that we are using the particular tone. If we have to explain something, we use that kind of a tone. If we have to reassure, our tone changes accordingly. So I hope it's helpful for you. Hit like, subscribe, and share as well. See you. Take care till we make the next video. Bye bye.